Good afternoon, students. Do you hear me? Okay. The lecture is devoted to bleeding and blood loss. Let's start the lecture. The lecture consists of 3 parts. First part, basic definitions, classification and pathophysiology. Yes. First part, basic definitions, classification and pathophysiology. Second part of the lecture, clinical diagnostic and additional methods of diagnostics, instrumental methods and laboratory tests. And third part, management of the hemorrhage, consists of general and local methods of treatment. So the first part of the lecture, there are basic definitions. So you should know 5 definitions. What is it, bleeding? Actually, bleeding is outflow of blood from heart chambers or blood vessels into environment, soft tissues, luminal hollow organs, or body cavities. Next definition: what can be considered as a cause of bleeding? Cause of bleeding is any nosology, name of disease or pathological state or trauma. So this is pathological condition complicated with bleeding. First of all, mechanical injury, traumatology. Traumatologic nosology complicated with bleeding because of nature of trauma is a mechanical damage to soft tissues and bones. Source of bleeding. What is the source of bleeding? Is anatomical area with injured and bleeding vessels inside it. What it means? It means injured anatomical part have vessels, damaged vessels. From the vessels, the blood flows outside of cardiovascular system, and this is the source of bleeding. Physiological parameter, volume of blood circulation. For calculation of volume of replacement of blood loss, amount of solutions should be infused intravenously. You should consider a volume of blood circulation. And this is amount of blood circulating in heart chambers and blood vessels. How to calculate the volume is very easy. In male, coefficient 70 milliliters per kilogram of total body weight. In female, 65 milliliters per kilogram per each kilogram of total body weight. You should multiply. In male, you should multiply 70 to weight of body of your patient. In female, you should multiply 65 ml to total body weight of female patient. And blood loss. What is a blood loss? Is amount of blood have been lost due to bleeding. Bleeding is a constant process, prolonged process since the trauma, and blood loss is a permanent process until the injured vessel will be stopped. You should consider that blood loss is a continuous process. You should stop the bleeding in your patient as fast as it possible. Classification of bleeding. Classification is dividing of pathological process into categories, into some aspects. We can define classification in compliance with mechanism of bleeding. There are 3 mechanisms of bleeding. Hemorrhagia per erection. Hemorrhagia is a Latin term, Latin name. Hemorrhagia per erection means bleeding due to mechanical damage of heart and blood vessels. Where can we see mechanical bleeding, hemorrhagia, pyrexia. Any wound. Bleeding is one of the obligatory symptoms of any wound. Fracture can be open or closed, but any fracture complicated with bleeding, even minor. Fracture of pelvic bones complicated with major bleeding up to 2 liters of blood accumulates in pelvic cavity or in near the bones, fractured bones. Any surgical operation. Surgical operation is a mechanical trauma. Surgical approach is incision to soft tissues. Incision means damage of vessels, cutting of vessels. So the bleeding is aspect of surgical operation. Invasive procedures and manipulations. Catheterization of blood vessels. Catheterization of peripheric arteries or veins for fibrinolytic therapy, for example, or for infusion therapy. Or catheterization of large veins, major veins, subclavian vein, jugular vein. Catheterization is mechanical injury to vascular wall. Second group of mechanical bleeding, second cause, hemorrhagia per diabrosium, is a bleeding due to erosion of the vascular wall because of any non-traumatic destructive pathology. As you know, pathology can be destructive, means destruction of soft tissues by pathological agent, by pathogens. For example, necrosis of infectious nature. Bacteria produce toxins, and toxins cause lesion to soft tissues, and decayed part, dead part of soft tissues can be decayed, can be melted, and together with vessels placed inside it. Trophic ulcer is a chronic circulatory disease of lower limbs. Peptic ulcer is a chronic disease of GI tract, stomach and duodenum. And decay of tumor. For example, decay of tumor of large intestine, colonic tumor. Decay of the elastic formation cause rupture of vessels and bleeding into large intestine. Hemorrhagia per diapedesium is a bleeding due to hypermobility of the vascular wall. Pathology of coagulation system. Various coagulopathy means deficiency of coagulative factors, depletion of coagulative factors. Low concentration of the factors cause low ability of blood to coagulate and to form blood clots as a protective mechanism of bleeding. Hemorrhagic vasculitis, inflammation of joints, inflammation of blood vessels, Inflammation of blood vessels cause increased permeability of blood vessels in that place, in inflammatory place, and migration of blood cells and components of plasma into interstitial space. Elementary diseases, for example, scurry, vitaminosis C, or general systemic inflammatory disease, such as sepsis. Sepsis is a general inflammation of body, general response, inflammatory response to body caused by bacteria. Second point of classification is anatomical classification. You know various types of blood vessels: arteries, veins, capillaries. So injury of arteries is arterial bleeding, cause arterial bleeding. In this case, blood outflows very fast under pressure because pressure in the artery is very high, like a pulsating jet of fluid, pulsating bleeding. The blood has ruby-colored color. Intensity of the bleeding is very high. Volume of the bleeding depends on diameter of the vessel and character of damage of the blood vessel. It means side trauma to blood vessel or cross-section injury of the vessel with opening of whole lumen of the vessel. Venous bleeding is a slow and gradual loss of dark red blood because venous blood is deoxygenated, deprived with oxygen, and appearance of the venous blood is dark. Intensity of venous bleeding is less than arterial one, but if the injured vein is major, for example, vena cava, superior or inferior, subclavian vein, brachial vein, the bleeding can be very severe, massive. At bleeding from veins of the neck, there is a great possibility of air embolism because of pressure. Blood pressure inside the large veins becomes negative during maximal inspiration. Capillary bleeding has mixed character due to damage of capillaries and small-sized arteries and veins at the same time. This is combined mixed injury because of arteries and veins traumatized at the same time and both oxygenated and deoxygenated blood presence in the wound or in the environment. And parenchymatous bleeding. The bleeding occurs at damage of parenchymatous organs, for example, liver, spleen, kidney, and lungs. Actually, it is a capillary bleeding, but usually it is more dangerous because the vessels in the parenchymatous organs are fixed to the stroma of the organ, and spasm of vessels as an initial part of coagulation is impossible because stroma fixes of the capillaries in open state. In compliance with clinical presentation, so depending on what symptoms we can see at bleeding, we can distinguish external bleeding and internal bleeding. External bleeding, when blood escapes from open injury, for example, wound of a body, to surroundings, and can be spotted very fast at the moment of the trauma. Bleeding from drainage of postoperative wound is also external because internal cavities drained by tubes as a physical antisepsis. Tube drainage is a physical antisepsis, and tubes lived in the cavities especially for control for postoperative bleeding. And bleeding can be internal. Blood keeps itself interluminal of hollow organs, tissues, or internal cavities. There are two types of internal bleeding. Obvious variant, when blood appears outside later, since the moment of bleeding, moment of rupture of the vessel. For example, gastrointestinal bleeding from peptic ulcer, pulmonary or urinary bleeding. And internal bleeding can be latent, when blood accumulates inside the body and cannot be detected by sight because spaces where the blood presence is closed because of anatomical feature. For example, hemoperitoneum, hemothorax, hemopericardium, or hemotrosis. In compliance with clinical course, classification of bleeding in compliance of clinical course. Internal obvious bleeding, the more detailed explanation. What is internal bleeding? Is a bleeding when internal obvious bleeding, when blood appears outside over time. As example, we can discuss stomach bleeding, when blood goes inside stomach and provokes vomiting. Blood inside the stomach reacts with hydrochloric acid and changes its color to black, so-called coffee grounds vomiting. If bleeding less considerable or ulcer localized in duodenum, vomiting is absent and blood passes into intestine and discharges with feces, which have black color and papy consistency. The name of the symptom is melena. Other sorts of internal obvious bleeding are hemobilia, is the blood in bile ducts, and hematuria, blood in urinary tract. Internal latent bleeding, second variant. Internal latent bleeding, when blood keeps itself inside various cavities and cannot be found by sight. As example, hemoperitoneum, bleeding in abdominal cavity, in the peritoneal cavity, between layers of peritoneum. Hemothorax, bleeding in pleural cavity, between layers of pleura, between visceral and parietal layers. Hemopericardium, bleeding to pericardial sac, and hematorosis, bleeding in cavity of joint. According to severity, according to degree of blood loss, we can distinguish the bleeding into 4 degrees. First degree, mild degree, mild blood loss. When the bleeding is from 10 to 12% of volume blood circulation, it is approximately 500 milliliters. Moderate bleeding, blood loss is from 15 to 20% of volume, total of volume of blood, from 500 to 1100 ml to 1 liter. Severe blood loss from 20 to 30%, it's from 1 to 1.5 liter. And massive bleeding, blood loss is about 30% of volume blood circulation, it's about 1.5 liter. In compliance with intensity, intensity means how much the patient lost his blood. Acute type, bleeding is massive during short period of time. For example, major trauma, pelvic fracture, heart wound, rupture of liver, rupture of spleen or lungs. And chronic type of bleeding. The bleeding is gradual with minor portions, sometimes within days, many days or weeks. For example, stomach erosions, chronic inflammatory diseases of GIT, stomach erosions, ruptures of mucous lining of the stomach, malignant tumors in initial stages of decay produce chronic bleeding, hemorrhoid pulse, varicose dilation of hemorrhoid veins, rectal veins, or benign tumors from female genitourinary system, such as fibroma. Since the bleeding starts, organism of the patient tries to compensate of blood loss, because blood loss is a very dangerous state, and for preservation of life, the organism tries to compensate of bleeding to maintain blood circulation in physiological systems and organs. Venospasm. Veins, as you know, veins are main capacitive vessels in the body. And the veins keep from 70 to 75% of blood volume. This is venous system is a capacitive system. One of the functions of the system is venous system, is keeping of blood. Tonus of the veins increases, this is vasomotor reflex, and the flow of blood can compensate depletion of blood loss by 15%. Second mechanism, attraction of interstitial fluid into bloodstream. Interstitial fluid means liquid presence between cells. This is third space, water space, interstitial space. Due to depletion of mechanism of mobilization, is due to depletion of blood volume and spasm of arterioles as a result of decreased cardiac output. This is vasomotor reflex, spasm of peripheric arterioles, and hydrostatic pressure in capillaries reduces, that cause involving of interstitial fluid into blood vessels. It causes autohemodilution, is a dilution of blood of the patient with interstitial fluid of the same patient. And blood volume increases by 10 or 15% during 5 minutes. It's a very fast mechanism of volume compensation. It's a very useful mechanism, and autohemodilution has the following effects. First effect, compensation of hypovolemia. Up to 500 ml can be compensated by hemodilution during 5 minutes. Improvement of rheological properties of blood, because viscosity of blood becomes less during reducing of hematocrit. And attraction of erythrocytes from the pool of blood, and restitution of oxygen capacity. Oxygen capacity is the amount of oxygen should be transferred by erythrocytes, and attraction of erythrocytes from depot is a compensatory mechanism of circulatory hypoxia. Next mechanism, tachycardia, a reaction of cardiovascular system. How the cardiovascular system can compensate a volume of minute volume of circulation. By tachycardia, hypovolemia decreases of venous inflow to heart and cardiac output, therefore venous return decreases, it leads to decreased cardiac output. And tachycardia as a result of sympathoadrenal activity can support sufficient cardiac output, but for a while, but for a short period of time, for a few minutes. Oliguria, hypovolemia causes hypersecretion of aldosterone and antidiuretic hormone of hypophysis. It results in increase of reabsorption of water, retention of sodium ions, and chlorides in kidney. Oliguria is a protective mechanism. Amount of urine decreases, so much volume of blood keeps in blood vessels. Hyperventilation. Hyperventilation increases cardiac return due to negative pressure in chest cavity. During deep inhalation, pressure in large vessels and right atrium becomes below zero, less than 0 millimeters of mercury column, and this produces involving effect of blood to blood from peripheral to the center, and venous return will be slightly increased due to hyperventilation. And peripheral arteriospasm. Spasm peripheral arterioles is an important mechanism of systemic arterial pressure support and keeping of blood perfusion in brain, heart, and lungs because of centralization of peripheral blood circulation. Clinical presentation of bleeding. Pathophysiological response to blood loss produces clinical symptoms. Clinical symptom is the external manifestation of bleeding. Regarding to clinical picture, we can recognize of various diseases and we can differentiate them from each other. Various types of bleeding have various clinical presentation, clinical signs. We can combine all the signs into clinical syndrome. Clinical syndrome is a combination of symptoms. There are 3 clinical syndromes. First syndrome, acute hemorrhagic syndrome, because of rupture of main vessels, massive bleeding, and due to loss of a lot of blood very fast. Acute hemorrhagic syndrome. Chronic hemorrhagic syndrome due to gradual loss of blood by minor portions. For example, we can see the chronic hemorrhagic syndrome in hemorrhoid piles, or ulcerative colitis or diverticulitis of colon. So in chronic diseases. Acute hemorrhagic syndrome presence in acute states, in very dangerous states. Chronic syndrome presence in chronic disease. And compression syndrome means squeezing of soft tissues and viscera with blood portion. Due to internal bleeding, there is a lump, internal additional volume, plus tissue syndrome, and the additional volume of blood portion, extravasated blood portion, cause squeezing and compression to adjacent organs. Compression syndrome can be caused by hematoma, with the presence of blood in soft tissues, hemothorax, presence of blood in pleural cavities, hemoperitoneum or hemocranium. Enclosed cavities, enclosed anatomical spaces, presence of additional portion of volume cause compression of internal structures of this anatomical compartment. Acute and chronic hemorrhagic syndromes both have general clinical sciences and local sciences. What is a general science? Is a general response, non-specific response of body to bleeding. Two mechanisms of general sciences. Due to hypoxia as a reducing of oxygen, saturation of blood with oxygen, and due to hypovolemia, due to decreasing of volume of circulation. Due to first mechanism, we can see weakness, dizziness, sleepiness, and yawing. Due to hypoxia of brain, because central nervous system suffers from hypoxia at first, very fast, prior to other physiological systems. Due to hypovolemia, we can see pale skin and cold skin due to peripheral vasoconstriction. First, the patient tries to drink water or solutions to compensate of blood loss. Tachycardia is a rapid pulse. Hypotension is a reduced BP. Both reactions of cardiovascular system to hypovolemia. And oliguria is a low urinary output, is a reaction of renal system, excretory system to loss of blood circulation. Local clinical sciences of internal manifest bleeding. Sciences of bleeding from the source of bleeding, from the site of bleeding. If the patient has pulmonary bleeding, we can see blood expectoration, red foamy sputum. The patient cough with foamy blood, brightly red blood, because all blood in lungs oxygenated, concentration of oxygen increased in the lung, and patient expectorates red foamy sputum. Esophageal bleeding, profuse vomiting with dark red blood clots. As you know, in the lower part of the esophagus, we have esophageal veins, then portocaval anastomosis, and dilation, varicose dilation of these veins due to liver cirrhosis cause rupture of the veins and produce esophageal bleeding. Profuse vomiting with dark red blood. Gastric bleeding. Coffee grounds vomiting due to presence of hematine in gastric juice. Bleeding to small intestine. Melena, name of symptom. Dark sticky feces containing partly digested food. And bleeding to large intestine. Dark red blood mixed with feces. And rectal bleeding, bright red blood placed apart to normal feces. Defecation with blood. In bleeding in the upper part of large intestine, the patient defecates with dark blood. Due to rectal bleeding, the patient defecates with bright red blood, arterial blood, and blood portions placed apart to normal feces, doesn't mix with them. Local clinical sciences of internal latent bleeding. Depends on localization also. You know, internal cavities and internal spaces which can contain blood. If blood accumulates in pleural cavity, the patient has hemothorax. Hemothorax is accumulation of blood which causes signs of restrictive respiratory insufficiency due to squeezing of lung parenchyma. Hemoperitoneum, this is intra-abdominal bleeding, local sciences of peritonitis, plus general sciences of blood loss. Hemarthrosis, bleeding in joint cavity, presence of blood in joint cavity. Joints becomes enlarged, outlines are smooth, palpation is very painful, soft tissues tensed, movement, active and passive movement in the joint decreased, so lump syndrome in the joints. Hematoma, this is elastic lump inside soft tissues. Signs of softening and fluctuation are positive. When you will study local periodontal diseases, you will study signs of softening and fluctuation. The lump becomes soft, and in the center of the lump we can palpate fluctuation, waving or movement of blood, liquid fluid in the cavity of hematoma. Hemopericardium is a bleeding to pericardial sac, symptoms of cardiac tamponade, acute constrictive cardiac insufficiency due to constriction of heart with blood if used in pericardial sac. And hemorrhagic, accumulation of blood in cranial cavity, manifests with general and local neurological disorders. Insult, such as hemorrhagic stroke. For diagnostics of the bleeding, due to physical examination, physical investigation, we can estimate primary diagnosis, clinical diagnosis. We have to confirm the clinical diagnosis with additional methods of examination. We should apply additional examination to find out, to discover place of bleeding, character of bleeding, arterial, venous or capillary, intensity of bleeding, and we should apply methods for examination for choosing of proper methods of treatment. We can use instrumental and laboratory methods of examination. Specific instrumental diagnostics. Diagnostic puncture is an invasive instrumental method which consists of puncture of cavity with blood and aspiration of blood for identification of the content of the cavity. Endoscopic examination can be non-invasive. We can use bronchoscopy, gastroscopy or colonoscopy. Flexible scopes for examination of GIT or respiratory tract. And endoscopy can be invasive. For example, laparoscopy, examination of peritoneal cavity, this is operative approach under narcosis. Thoracoscopy, examination of thoracic or pleural cavities. Arthroscopy for examination of cavity of joint. Ultrasonography, non-invasive echographic examination of soft tissues and cavities. Ultrasonic symptom of bleeding is accumulation of blood between anatomical structures, among anatomical structures. And last methods, angiography, plain radiography, computed tomography, and magnetic resonance imaging. X-ray methods of examination. They can be non-invasive and invasive. Invasive variants are angiography, injection of contrast into bloodstream and examination of localization of the contrast, discovering of localization of contrast and defining place of rupture of the vessels. Both invasive or non-invasive X-ray diagnostics are applicable for detection of pathology of parenchymatous organs and body cavities. Very useful method for diagnostic of bleeding inside the parenchymatous organs, inside the cavities. For example, brain intracranial bleeding can be defined by angiography, computed tomography or magnetic resonance. Intraperitoneal bleeding, the same. We can find liquid in CT scan, for example. Technique of diagnostic puncture is a common surgical procedure, very widespread. Different variants of diagnostic puncture. We can perform abdominal puncture, laparosynthesis, or peritoneal or pleural puncture, thoracosynthesis. On the slide you'll see abdominal puncture with aspiration of intra-abdominal fluid. Under local anesthesia or under narcosis, the doctor performs puncture of peritoneal cavity near the umbilicus along the linea alba and insert special needle with blunt tip into peritoneal cavity and aspirate the content of the cavity. Prior to aspiration, the doctor can inject some physiological solution for increasing of volume of intraperitoneal fluid and aspirate the content. Presence of blood in the cavity indicates to intraperitoneal bleeding. Laparoscopy, invasive surgical optical examination. This is invasive diagnostics of intra-abdominal pathology. Universal methods of diagnostic. We can diagnose bleeding, perforative states, peritonitis, tumors, state of liver in cirrhosis, degree of cirrhosis. So in this particular case, the doctor performed laparoscopy for suspicion of rupture of liver. The doctor suspects intra-abdominal bleeding because of trauma of the liver. He performs laparoscopy, and he can see blood clots present near the liver. It means presence of bleeding around the liver. There's also bleeding is injury of parenchyma. How to measure blood loss? Very important aspect is measuring of blood loss, calculation of blood, amount of blood effused from the blood vessels. If the bleeding is external, we can perform measurement of blood volume. The technique is possible if the bleeding is external or blood can be collected from internal cavity. If the cavity can be drained and blood can be collected and measured in jar. Very simple method. Measurement of intraoperative bleeding. Second variant of measurement. Weigh the blood-soaked tampons on the scales. After finishing of the operation, operating nurse can collect of the tampons used during surgery and weigh them. 1/2 of total weight of soaked dressing material is equal to blood loss measured in milliliters. For example, total weight of tampons, soaked tampons, 1 kilogram. So the patient has lost 500 ml of blood. And indirect method of calculation, Algora's index or shock index. Very simple formula, dividing heart rate by systolic blood pressure. In normal state, we have Algora shock index is equal to 0.5. If the shock index consists 0.5 to 1, it means blood loss approximately from 20 to 25%. From shock index from 1 to 1.5 up to 40%, and above 1.5, blood loss is massive, above 40%. Other method of clinical laboratory measurement of blood loss is combined method, considering level of hemoglobin and hematocrit. We can consider presence of clinical symptoms and laboratory tests. For example, if the clinical signs are absent, but hemoglobin reduced to 100 grams per liter, and hematocrit slightly normal, slightly below normal variant, 0.44 or 0.4. It means mild bleeding to 10% of volume circulation. If the patient has moderate tachycardia and hypotension, the skin is pale and limbs are cold, slight tachypnea, hemoglobin reduced 99 to 85 grams per liter, and hematocrit reduced also 0.39 or 0.32. It means moderate bleeding. Blood loss can be 1 liter. If the tachycardia is severe, to 120 beats per minute, or blood pressure less than 100 millimeters of mercury column, the patient has general symptoms of blood loss, general dizziness, profuse sweat, pale skin, cyanosis, dyspnea, oliguria. The blood loss is severe, up to 30%. And critical state of the patient. Tachycardia above 120 beats per minute, blood pressure considerably decreased, 60 millimeters. Very severe mental disorders such as stupor, extremely pale skin and anuria. The patient's state is very severe, critical state, because he has a massive bleeding. Blood loss can be above 1.5 milliliters. 1.5 liters. Hemoglobin decreases below 70 grams and hematocrit below 0.23. Take a break for 10 minutes. We have a break. After the break, we resume the lecture. Third part of the lecture will be devoted to management of hemorrhage. How to manage the patients with various types of hemorrhage. Please, 10 minutes break. So, let me resume my lecture. Third part of the lecture, principles of hemorrhage management. How to manage a patient with bleeding, the patient with bleeding, with hemorrhage. There are principles, some principles of management. First principle of the management, to stop the bleeding immediately with any method as soon as it possible. This is first aid, pre-hospital management. Any patient with bleeding should be treated in hospital, inside clinical hospital. Before delivering, before admittance of the patient to the hospital, you should stop his bleeding, because bleeding is a life-threatening state. To perform a surgical operation if it's necessary for final arrest of bleeding. This is intra-hospital manipulation. Only inside a hospital you have equipment and instruments for safe making of surgical operation. Hemostasis can be achieved with mechanical, physical, chemical or biological methods. Hemostasis is the arrest of bleeding. First, two principles. To stop the bleeding immediately with any method as soon as it possible. This is first aid. And to perform surgical operation. This is final hemostasis. Or application of another methods for final arrest of bleeding. To remove the intravascular volume depletion. This is correction of blood loss. Replacement of blood loss. Can be achieved with infusion therapy, intravenously blood substitutes, or transfusion therapy, intravenous blood components. Principles of infusion therapy. To improve and maintain the central hemodynamic, to improve the microcirculation and rheological properties of blood, to normalize the transcapillary exchange, and to normalize both gas capacity and gas exchange function of blood. Mechanical hemostasis. Application of mechanical methods. Mechanical factor means handling with injured blood vessels. Temporal methods means first priority aim. This is pre-hospital management. You can use application of tourniquet. Is a squeezing of blood vessels with circular elastic rope. Indications to application of the tourniquet are arterial bleeding from limbs or any massive bleeding from limbs from other blood vessels, from venous or capillaries. The feature of this method is a complete arrest of circulation in peripheral part of the limb. It provides very reliable hemostasis, but at the same time causes severe ischemia of tissues, nerves and vessels. So the tourniquet mustn't be used over 2 hours on lower limb and over 2.1 hour on upper limb. If transportation of the patient with a rope takes a long time with the rope must be periodically removed for 10 or 15 minutes. The bleeding must be stopped instead with another temporal methods. Inside a hospital, you will provide constant hemostasis. Mechanical temporal hemostasis, other methods. Pressing of the bleeding vessel by finger to a nearest bone. The method is very simple. Indication for the method is arterial bleeding from arteries localized superficially above the bone, to which the injured vessel can be pressed by finger. Maximal flexion of limb. The method is effective at bleeding from thigh. You can flex hip joint, extremity in the hip joint. From a shin and foot, maximal knee flexion is effective. And from hand and forearm, maximal flexion of elbow in elbow joint. Elevated position of limb. It means elevation of injured extremity. Elevation of injured extremity in upper position. The method is effective for stoppage of minor bleeding. It's just enough to elevate the injured extremity. Indication is venous or capillary bleeding from limbs, upper or lower limbs. Pressure bandage. It's used at moderate bleeding from small vessels, veins, or capillary bleeding from varicose veins of lower limbs. The technique of pressing bandage is to put a few sterile napkins above the wound and wrap around with gauze bandage tightly until the bleeding stops. Keep the bandage until the bleeding stops. Tamponade of a wound or cavity. It's a plug. Tampon is a hemostatic tampon. It's a plug of material used to stop a wound and absorb blood. It's often used during operations, and after arrest of bleeding, the plug must be removed. Constant methods of mechanical hemostasis means surgical operation. Few types of surgeries. First type, ligating of blood vessels by threads, surgical threads. Vascular suture, secular suture, or another type, side suture. Embolization of blood vessels by chemical or biological emboli. This is method of arrest of bleeding in brain, for example. Clipping of blood vessels, application of clips, metallic clips on the vessel. And vascular suture in reconstructive vascular surgery. Grafting, shunting of the vessels, and replacement of restoring of anatomical practicability of blood vessels. Physical hemostasis. Physical hemostasis means application of physical methods. Physical methods, application of physical factors to the bleeding area. You know some physical factors, such of them temperature and irradiation. We can use low temperature methods, for example, ice pack or cryosurgery. Mechanism of action, how the low temperature stops the bleeding. Because of spasm of vessels, blood flow becomes slow and possibility of thrombosis becomes high. Blood flow becomes slow and intravascular thrombosis begins. Subsequent mechanisms, spasm of vessels, blood vessels become slow and intravascular thrombosis begins. Hot temperature methods. Application of high temperature should be from 60 to 100 degrees. Mechanism of action on the high temperature. Coagulation of blood vessels and local intravascular blood clotting. Coagulation of blood by high temperature. Few techniques of application of heat. First, application of hot sterile solution on a bleeding surface. The technique is charge your surgical tampon with hot saline solution and apply to the bleeding surface. The method is very useful for for hemostasis in parenchymatous organs. Diathermal coagulation using of electricity in mono or bipolar variants. The method enables precise coagulation of small vessels with the electric current. Application of electric current topically in the place of application of current, coagulation of tissues begins and bleeding begins to stop. And application of laser radiation. CO2 and argon lasers work with a non-contact technique. It means you needn't apply instruments directly to soft tissues. You should apply energy. The effect of the laser is primarily thermal. Energy of the laser becomes coagulation. The photonic energy is converted into thermal energy at the level of tissue. It means heating of the tissue by photonic energy produced by laser. Argon plasma coagulation. Mechanism of action of argon plasma coagulation is blood vessels, charring of blood vessels and local intravascular blood clotting. Argon plasma coagulation follows the principle of unipolar coagulation without direct contact to tissue. The thermic energy is applied by an ionized argon flow and is used for coagulation diffuse bleeding at surface and parenchymatose hemorrhage. Means large bleeding surface can be coagulated by argon plasma beam. Ultrasonic dissection. Ultrasound oscillating at a frequency 55,500 of Hz leads to a coagulation temperature between 50 and 100 degrees. Ultrasonic dissection separates tissue with a cavitational effect and achieves hemostasis by disrupting protein structure and forming a coagulum. Ultrasound produces minimal local heat because temperature of coagulation below 100 degrees. We can use chemical hemostasis, means chemical drugs applicable to local surface, sterile of course. We can use hydrogen peroxide, a mechanism of hemostasis, liberation of oxygen and promotion of liberation of thromboplastin. We can use vasoconstrictors, epinephrine or norepinephrine. These drugs cause vasoconstriction and hypoperfusion in soft tissues. Inhibitors of fibrinolysis, for example, aminocapronic acid, it decreases lysis of intravascular blood clots by fibrinolytic system. And derivatives of gelatin, name of the drug, gelaspone, releasing of thrombotic factors from platelets and aggregation of thrombocytes in the place of bleeding with forming of primary platelet plaque. General hemostatic drugs, chemical drugs, we can apply intravenously or intramuscularly. As systemic application, we can use aminocapronic acid. This is inhibitor of fibrinolysis. Calcium gluconate, this is clotting factor. Disinone, the drug accelerates formation of thromboplastin. Etamzilat, the drug stabilizes of vascular permeability, decrease of the vascular permeability. Pituitrinum, the drug is used in obstetrics. The drugs cause constriction of myometrium and arrest of uterine bleeding, postpartum bleeding. And Vicasol, widespread drug, stimulates of synthesis of coagulation factors in liver. Biological hemostasis, application of drugs of biological nature. Local methods used in surgical operations. We can pack our bleeding surface with autologous tissues from the same patient. It means packing of the operation wound by flap of omentum major or muscle tissue. We should isolate of omentum flap or isolate of muscle bundle and tightly pack with stitching into wound, into bleeding area. We can use thrombin locally only as a powder for the wound sprinkling of the wound with thrombin. This is a powder. Fibrinogen and thrombin are components of hemostatic fibrinous glue. We can seal off the line of sutures in vascular grafts. Cardiovascular surgery, hemostasis in cardiovascular surgery is based on gluing of the line of sutures with fibrinogen and thrombin. And absorbable gelatin sponge is a lyophilized plasma, dried plasma, soaked with thrombin, ions of calcium, and inhibitors of fibrinolysis. We can use them topically for packing of the bleeding surface. General methods of biological hemostasis is intravenous infusion of drugs with hemostatic activity. Tracelol or contrical, these are inhibitors of fibrinolysis. Plasma, is a blood component. You can use native plasma or fresh frozen plasma. Platelet concentrate is a suspension of thrombocytes. And remedies for treatment of hemophilia, such hemophilic plasma and anti-hemophilic cryoprecipitate. How to choose necessary drugs for performing of principles of replacement. First principle, improvement and maintaining of central hemodynamic. Basically, we can use drugs for correction of volume of blood circulation. We can use blood substitutes with hemodynamic action, such as ionosterol, albumin, this is blood component, and fresh frozen plasma, also blood component. Other drugs are blood substitutes. Voluven, Rifortan, and Stabizol. The action is compensation of volume of blood loss. Second principle, improvement of microcirculation. We can use such drugs as Reasorbilact, Trental, or Rifortan. They decrease viscosity of blood and improve circulation of blood in capillaries. Next principle, normalization of transcapillary exchange. We can use ionosterol, Ringer solution, or saline solution, normal saline solution. These are crystalloids. And normalization of gas exchange and gas capacity. We should use packed red blood cells, donors, erythrocytes, for correction of gas capacity of blood. Indications for transfusion of blood components. Hemostatic therapy with blood components has very strict indications. Erythrocytes, we should transfuse if hemoglobin level is less than 80 grams per liter or hematocrit below 25% or 0.25. Fresh frozen plasma, when the prothrombin level below 60% or fibrinogen level below 0.8 grams per liter. Albumin, when the whole protein level below 40 grams per liter or serum albumin level below 25 grams per liter. And we should transfuse platelets if the patient has thrombocytopenia below 50 billiards per 1 liter of thrombocytes. Next principle, quantitative and qualitative replacement of blood loss. Principles of replacement of blood loss. First principle, we should assess degree and amount of blood loss. We should calculate how many liters or milliliters the patient lost because of bleeding. Next step, we should assess amount of infusion therapy. We should calculate how many liters you should infuse to the patient's bloodstream for replacement of blood loss. And you should adjust kind and ratio of solutions. You should adjust various types of solutions, calculate their portions, need to be infused. I mean blood components, colloids and crystalloids. You should use 3 types of solutions: blood components, blood substitutes, colloids and crystalloids. The technique is very simple. You can see table for calculation of infusion therapy. Depending on total volume of blood loss, we can calculate of volume of infusion, total volume of infusion. And depending on percentage of total volume of infusion, we should calculate parts of infusion therapy. For example, the patient has moderate bleeding. He has lost 1 liter of blood. So you should replace 2 times more, 200% of volume solution. Totally volume solution, you must infuse 2 times more. It means 2 liters. It equals 2 liters of artificial solutions. From 2 liters, you can use crystalloids and colloids. You mustn't use any blood components, crystalloids and colloids. You should divide 2 liters into 3 portions, and 2 portions should be equipped with crystalloids and 1 portion by colloids. The technique is very simple. And short characteristics, brief characteristics of blood components. Blood components in therapy of bleeding. You can use 3 types of blood components. First, red blood cells, packet erythrocytes. 1 unit of packet red blood cells is processed by the removal of platelet-rich plasma from a donated unit of whole blood and contains approximately 200 ml of red blood cells. In the bottle, additionally to the 200 ml of erythrocytes, we can put less than 50 milliliters of plasma. 50 ml remains in the bottle with erythrocytes, and additive, it means conservants or stabilizer, that brings the total volume from 250 to 300 ml. Depending on the additive, the storage life at 4 degrees is from 21 to 35 days. Depending on the additive means depending on the type of conservant. If you will use glugicir, you can keep your blood, donor's blood, 25 days. If you will use silifat, 35 days in 4 degrees Celsius, in refrigerator, of course. And red blood cells should be ABO and Rh compatible to your patient. Type O is the universal donor type for RBCs, or erythrocytes, but in dose less than 500 ml. Indications for transfusion of erythrocytes. Indication is acute post-hemorrhagic anemia with hemoglobin level less than 80 grams per liter. Next blood component, fresh frozen plasma. 1 unit of fresh frozen plasma is the plasma taken from a unit of whole blood. Unit of whole blood deprived with blood cells, and you will have native plasma. After freezing of the portion of the native plasma, you can take fresh frozen plasma. Made from the whole blood within 8 hours of collection. Contains all coagulation factors in normal concentrations, but effects may only last 4 hours. It depends on half-life of 8th factor. The plasma is a solution medium free of blood cells, erythrocytes, leukocytes, and platelets. The plasma must be ABO compatible to the patient. Donor's plasma must be ABO compatible to blood of recipient, and type AB of donor is the universal donor for the plasma. Indications for transfusion of plasma is a continuous bleeding or major trauma or major surgical operation for keeping of volume of blood circulation, oncotic pressure in sufficient level for patient survival. And last blood component, effective for hemostasis, is a cryoprecipitate. Cryoprecipitate is a solution, precipitate, collected from frozen plasma at 4 degrees Celsius. The concentration of fibrinogen in cryoprecipitate units is up to 10 times than fresh frozen plasma. And cryoprecipitate contains specific clotting factors from plasma, such as factor 8, factor 9, fibrinogen, and von Willebrand factor. Indications for transfusion of fibrinogen of precipitate is hypofibrinogenemia, less than 1 gram per liter, hemophilia, and dysfibrinogenemia. And overall, how to estimate efficiency of transfusion therapy. You have 4 laboratory tests, 4 laboratory parameters. You should consider them after, during infusion therapy, and after finishing of the treatment. If the central venous pressure of your patient increases and from 50 to 120 millimeters of water column, systolic arterial pressure rises above 100 millimeters of mercury column, the patient produces of urine and diuresis is above 0.5 ml per each kilogram of the patient per hour, and his hematocrit is above 0.3, you should consider your therapy is effective. Of course, you should take into consideration clinical state of the patient. His skin becomes pink, his consciousness should be restored, he should be unconscious, dry should be moist, and patient should be aware of his condition. My lecture is finished. Please, if you have any questions, you can ask me the questions. If you do not have any questions, let me finish my lecture. See you next week.